Hey everybody, it's Lee and Bridget. We're here from King Harvest and kingharvest.org. We just wanted to ask and answer a few of the questions that we've been getting from our members lately. Most specifically, recently, we've been getting a lot of questions about different kinds of hard tissue or organ cancers, vital organ cancers. We see a lot of that kind of stuff, liver, kidney, liver bile duct, that kind of thing. And with Western medicine, as you know, those kinds of cancers are particularly stubborn, and those kinds of things get you put into hospice quicker than most kinds of cancers, and so we see a lot of it. So we're going to ask and answer some of the questions that we see recently from our members. So let's get started.
Okay, so the first question is, how does cannabis help treat organ cancers?
Okay, so cannabis oil will help treat organ cancers in two ways. It's going to help the organ itself re-regulate and rebalance, similarly to doing like a cleanse or adding supplements, and it's going to help you re-regulate. If it's in the case of a decomposition, it's going to help tissue from becoming necrotic and degenerating, like kidney failure, liver failure, those kinds of things. Even in the case with heart muscle, and we see that too. But more importantly, just as it works with other types of cancers, we see we want to try to produce the entourage effect by stimulating the endocannabinoid system, and different kinds of cannabis oils, because the material in the tissue is so much denser, seem to work differently and work better. But it works to treat organ cancers because we're going to try to alleviate the symptoms and reverse the underlying cause of the cancer itself with the entourage effect. But we're also going to be addressing the ability to protect the organ itself and to keep it as plastic and as young as possible. And that, of course, the chemical responsible for that is going to be the CBD.
Okay, so what would be the best method for taking cannabis for prostate cancer?
Very good question, because as you know, we have cannabinoid receptors in our mouth, throughout our GI tract, stomach, and our organs, and also 40% of our cannabinoid receptors are in our colon. So a prostate cancer patient should take medicine orally, and also, in my opinion and our suggestion, it would be half of that would be taken rectally via suppository as well. It's a lower abdominal cancer, right? It's not an extremity cancer, so especially in men, when you see abdominal cancer, like located, prostate cancer tends to be very stubborn, and so as with any cancer, we want to get it from as many cannabinoid receptors as possible, but particularly in the case of prostate, because it's located near the colon, you want to use oral and suppository administration. Absolutely.
Okay, absolutely. So would it be the same method for treating liver cancer?
Yes, absolutely. It would be a slightly different ratio because of the different functions of the organs themselves. The prostate cancer is going to have a much higher THC. The liver is the single organ that is at the center of it all. So with the liver, we're going to use something called 1-to-1, which is half ACDC and half indica oil. Mm-hmm. We're going to try to reset, rebalance, or quote-unquote turn on the liver so we can rebalance and reset the rest of the body's systems. Once you turn on the liver, all the other metabolic functions, as in my case, like literally in my case, turning on the liver will, can cause your life to be changed or saved.
Mm-hmm. Absolutely. Okay, next question is there a specific CBD THC ratio of cannabis that you would suggest for organ cancers?
Different types of cancers are going to get different ratios. The more stubborn the cancer, you're going to look at a ratio that's a little higher in THC, something like 75% THC to 25% CBD. As you get into softer tissues or the liver itself, you look towards something like 1-to-1. If it was a lymph cancer or an endocrine cancer, you'd also be looking towards a 1-to-1. But as you move towards things like connective tissue, osteosarcomas, liver bile duct, pancreatic cancer, denser materials and harder to, or like splenitic, spleen-based cancers, they're in more difficult areas, they're harder to get to, and so we need those higher concentrations of THC to break it up, and during the entourage effect, right? So otherwise it doesn't seem, those types of cancers seem to be a little more stubborn, and so you need a little more THC. In some cases too, prostate cancer won't have a CBD receptor on it, and if that is the case, that's a very specific diagnosis. Obviously we make diagnosis specific cannabis oils, right? But in that specific diagnosis you don't want any CBD at all. Okay.
All right, the last question is then, can I use cannabis in lieu of chemotherapy?
We will always tell you to use cannabis oils in conjunction with what your doctor is telling you, not instead of, always in addition to. Critical illness cannabis oils are going to protect you from radiation and chemotherapy. They're also going to make those modalities more effective for you. You're going to be able to continue to metabolize food, sleep better, stay out of pain, and you're not going to degenerate from all the toxicity as readily. So, can you use cannabis in lieu of chemotherapy? Yes, people do. The people that have the greatest results are people that do everything, right? It doesn't really matter what one thing gets you better. The idea is that you do everything you can to improve and change your life and improve the quality of it. So, if you are somebody that is looking to do that, if you're someone who's looking to enter onto a journey of healing, King Harvest wants to help you. So please visit us here at kingharvest.org, and also visit us at CBD Community of California on Facebook. It's a private forum where you can ask and answer any questions you need to with our patients themselves. So again, this is Lee and Bridget. We're here to help. Call us with anything you need. Happy healing.
Happy healing.
Hi everyone, this is Lee from King Harvest and kingharvest.org. I wanted to take a moment and thank you all for watching. If you like this video, please go ahead and subscribe or click on one of the videos to your right. Further, if you have any questions or comments, go ahead and leave them below. You can also visit us at kingharvest.org. Thank you again, and happy healing.